Hi, Dr. Kevin Zorn from BPH Canada, here to talk a little bit about SpaceOAR, a new product that's available to help men who are about to undergo radiotherapy for their localized prostate cancer in order to protect the surrounding structures for the bladder, the erectile function, and most important, the rectal space. So when patients are going to undergo radiation therapy, there's a 10% chance that they may have some injury from the radiation therapy to the lining of the rectal wall. So that sits within a centimeter or two from the prostate. So let's see what that looks like. So this is in some sense, a burn of the rectal wall, which is in some degree permanent. That's usually of a slow outcome. So it doesn't happen right during radiation, but over the next few months after a man undergoes radiation, those are chronic changes to the rectal wall in which there's multiple superficial veins and arteries that grow on that scarred rectal wall, which are very friable. So patients will have not only rectal wall symptoms of sense of going to the defecate, but also to have bleeding in their stools. So again, something that's quite debilitating in 8 to 10% of reported patients. So what's come in the last few years? Well, actually, Boston Scientific has developed something called SpaceOAR, which is a dissolvable gel that's inserted just with a simple needle. So the urologist or treating physician would place a ultrasound in the rectum, and then through the perineal wall, just the skin in the perineum, insert a small needle under a local anesthetic. This takes less than 5 minutes, and it's a gel. It's just a separator. It's a barrier that will be inserted gently under a small long needle into that space. It is creating another centimeter or two distance from the edge of the prostate and the rectal wall. Very simple. It's an inert, absorbable polymer. It's really kind of a water and gel that will create almost like a little layer of jello that's there for about 6 months. And that doesn't interfere with radiation, doesn't delay treatments. Again, there it is. It's just the placement of this gel in that space between the rectum and the prostate, which separates by a centimeter or two. And at least from some of the data that we're seeing in regards to the therapy, here's a sagittal view, here's the prostate, and that's the zone where radiation is delivered. You can see here that anterior rectal wall, well, it's in the hit zone. It's going to get radiated. That's where we get that radiation proctitis. And if we can add the SpaceOAR in, it gives the patient a 6-month buffer. You can see the maximal radiation to treat that prostate cancer leaves the rectum out. So what do we see in terms of the published outcomes? Well, guess what? Not only do we have fewer bowel injuries or complications, getting down from 8 to 10% to less than 1% in several randomized studies, well, guess what? It also helps avoid or minimize urinary complications. So again, the bladder is nearby. It can also be impacted. And very important thing for men too is the fewer sexual complications. So better preservation of erectile function with a simple 5-minute gel insertion. So to learn more about SpaceOAR, come visit us at bphcanada.com. There's also the Boston Scientific website to help find a locating physician near you to have this therapy if you're about to go or one of your family members is about to undergo radiation therapy.